Dr. Rosalind Jackson, Dr. Roz, is a board-certified obstetrician and gynecologist and a member of the American Academy of Anti-Aging Medicine. She encourages her patients to think of their mind, body, and spirit when it comes to their health. And her purpose is to help you feel fabulous so you can do fabulous things. She meets patients who have been told that nothing can be done to alleviate menopausal symptoms. And she invites you to choose your health language. Choose, I feel energized, versus I'm tired. Choose, I can do this, versus I'm so stressed out. Choose, I love me, versus I feel hopeless. Take charge of your health and speak truth over your life. It's the only one you have. And she wants women to feel like they matter. Well, Dr. Roz, you are speaking my language. I mean, I have to tell you, I don't know if I was always too busy to have any symptoms of anything. But, you know, I worked till 9 o'clock, had my son at 12. I never had I had menopausal symptoms. I mean, I remember being on stage and the sweat pouring off of me and meeting people and the sweat pouring off of me. But I was never depressed or tired or any of those things. And I wonder if it was because I was just always so busy doing that I never had, you know, time to think about what might be going on with me. But you ask whether or not that we know that there's a new pill out. Now, a new pill for what?
Well, one of the common things that I see with the perimenopausal and menopausal woman, one of the most common things is I have no desire for intimacy. And so the new pill that's out, it's the little pink pill. You know, the guys have the little blue pill, but for the women, it's the new pill that's out. It's called Addyi. I'm not a speaker for that pill, but it's just the fact that there is hope now. There is something else that women can do versus not do anything about it, and recognizing that there really is a problem and that women can certainly enjoy a healthy sex life or improve their intimacy.
Well, how is it different than Viagra?
Well, Viagra, you can use that as needed, you know, when it's needed. It works physiologically on vasculature, you know, to help improve erectile dysfunction. With this pill for women, it's not something that you can just take on the spot, like on demand, unfortunately. It's something that has to be taken daily. So for a period of time before you really experience a difference in your libido. So that's how it's really done. It's not on demand. It's something that has to be taken on a regular basis.
And is it so new that they really don't know the side effects yet, or have studies been done on that? Or, I mean, I would think that some people would be a little bit leery of taking something that's brand new.
Well, that's very common because, you know, long term, what kind of side effects would there be? But whenever there's something that's newly FDA approved, you better believe there's been a lot of study on it. The one thing about this particular medication, and it's that it's the first thing on the market for women, and it's actually been presented to the FDA a couple of times, but they needed further study just to make sure that it is something that women can take and not have any major adverse effects with it. There are some side effects, however, but when you say that, you know, is there going to be something long term that you have to look out for? That's with any medication that you take.
Well, that's true. That's true. So what are some problems for the female libido?
Well, when you think about problems with the libido, you have to first, you know, and this is not talking about the medication, just in general, you have to identify what's causing the problem. You know, is it because my hormones are low? I mean, you have to look at that. Is it because I have pain within course? So that's going to warrant a visit to your physician and doing an examination to see, you know, what's going on. You know, a lot of times, and it's unfortunate, women confuse their pap smear with a pelvic exam. There's a lot of data out there now, and it's been in the media, that women only need their pap smear every 3 years. Well, the problem with that is they interpret that as I only need my pelvic exam every 3 years, and that is not the case. So a pelvic examination when it regards to female decreased sexual dysfunction or decrease in libido, it could be because I have pain. And if I'm having pain, I'm not going to want to engage in intercourse. And so that's important. So it could be hormonal, it could be pain. There's the emotions behind that. Are you in a good relationship? It's body image behind that. Are you happy with you? And then if you're happy with you, you're more likely to engage in a healthier sexual intimacy with your partner.
Well, that's true. That's absolutely true. But you also talk about some alternative treatments for female sexual dysfunction. What kind of alternative treatments are there? Because I have to say, I don't think that I have really been aware of that many.
Yeah, so this is a very good topic to talk about because it's very, very important for any relationship. I mean, intimacy is important in every aspect of your lives, I would say. But when you talk about alternative therapies, other than the new medication that's out, that little pink pill, you have to get to the root of the problem, like I just spoke about. But one of the things that I'm a huge fan of, and it comes to hormones, and that's the use of testosterone. A lot of times, that's not presented to a woman as an option. At all. In fact, hormones in general, bioidentical hormones, would not be even presented to a woman, which is kind of like conventional medicine, but you have to step outside of that. But there are tremendous benefits to using testosterone therapy in women. Now, we don't need as much testosterone as our male counterparts, but certainly prior to menopause, we did produce testosterone, and that certainly helps with the libido and so many other things as well. So one of the alternatives would be testosterone therapy. There's lots of herbal supports that are available to help in that area. Talking with a sex therapist to get to the bottom line of anything that's emotional that's preventing a woman to have the best intimate relationship that she could. So you have to explore all aspects, like what's going on. It all starts with a conversation with your patient to find out or to get to the root of the problem.
Well, now going back to testosterone, I mean, I have heard of that. I did hear of that. I would think that women would be a little bit leery of this, and I would ask, how is it basically administered? I mean, is it through injection? Is it through a pill? I mean, how do you find out how much a woman really needs?
Yeah, that's a very, very good question. And I always start with my patients at looking at their hormone levels. I absolutely do some kind of objective workup to find out how much testosterone a woman has, and that helps gauge how much they need. And the medication is delivered via a cream. I do not use, and it's not recommended that a woman use it orally, so it could be in the form of a cream. Also, there's testosterone pellets. Now, pellet therapy, it truly is that. It's a pellet that gets injected, usually in the upper part of the gluteus, and it lasts for about 4 months, and then it wears off, and then you put another one in. And so it's like every 4 months you visit your doctor to have your hormone therapy. Now,
and have you found a preference among your patients?
Well, I let my patients dictate that. I offer both. Some may start with the cream and then convert over to a higher dosage because I can get a lot higher with the pellet therapy, and then all the added benefits that comes with it. Like good night's sleep. It helps with losing weight. It helps with your vasomotor symptoms, mental clarity. So there's tremendous benefits to using that. There are some side effects in any form of whether it's the cream or the pellets. But definitely with the pellets, you can get a higher level of testosterone in, but you still want to make sure that you're not super physiologic with this. You're definitely not giving the amount that you would give to a man. And men go through andropause. Men need testosterone as well.
Wow. Amazing.
It is. It really is. And it's all about, living healthier, living happier, and you just have to replace some of the things that you naturally lose. So I don't think I've ever been into, you lose it and then you're done. I just like to replace.
Well, do you think that a woman's lifestyle makes a difference. For example, if she exercises a lot, if she eats properly, if she's an active person, do you think that the symptoms of menopause are less? Do you think that her reaction to things or her sexual abilities, all of that have an impact on how she lives her life?
Absolutely. Hormones do not act in isolation. It's not the end all. I can get a patient feeling fabulous with their hormones, but you have to consider other things as well. Her longevity, her energy level. There's so many things, and certainly that comes with exercising regularly for cardiovascular protection. The number one cause of death for a menopausal woman is cardiovascular disease. No matter how much testosterone cream or bioidentical hormone cream I give you, there are some benefits to cardiovascular protection, but it comes along with I'm eating well, I'm eating good food, foods that's not processed. You have to eat a more mature diet is what I tell patients. You can't eat what you ate in your 20s for sure. You have to exercise. It's how you deal with stress. Stress is a major, major culprit for most diseases in America. It's how you deal with that. And a lot of times, some women internalize that. And so certainly when you say if you have someone who's eating well, who's exercising, deals with stress a lot better, that person, will probably handle a lot of these menopausal symptoms a lot better than someone who is not.
Well, I think that's so true. I mean, one of the things that my theme is always let's get moving. Let's get moving however we can, whether it's walking or biking or swimming or yoga or Pilates or aerobics or whatever it happens to be. I believe that you have to move. And I have to tell you, if I ever looked and really took seriously, which I know you're going to tell me I should, at the side effects of any medication I take, and I don't take very many, I wouldn't take the medication because there are so many things they warn you about. Luckily for me, I've never had any reaction to that, but, it's scary when they tell you all of the side effects that could happen. So that's
sure.
why I was curious about that little pink pill,
Yeah, I mean, with that little pink pill, it's not my first line therapy, but just letting women know that there is something out there that may work for them, and everybody's different. It's only indicated for the perimenopausal woman, not the menopausal woman. So you have to there's so many things to consider. One of the things, and I shared this with just a few patients when it first came out, you cannot drink alcohol with it. And right off the bat, I had patients, I don't know if they were joking or not, like, well, I don't want it. You have to give up your glass of wine at night. So, there are some things, there are pluses and minuses to everything that you do, but I certainly agree with you, Dr. Gale, that, the more natural approach is definitely going to be better for you in the long term, because when you take a lot of medications, one, they interact with each other, and two, there can be a lot of side effects. And then long-term use, what is it causing, 1 year, 5 years from now, by taking any medication? And so you have to monitor those things as well as supplements. A lot of times, patients take things in their own hands, and they go out and they're just loading up on supplements. And I'm a huge fan of that. But I believe also in monitoring that, because you can have interactions, or you can have a level that gets really high and it can cause problems. So, but hands down, I love the natural approach to things. You're eating good food, you're taking appropriate supplements. There's ways of testing that. You can test everything. You can test to see what micronutrients or minerals I'm deficient in, so then you know what to take. And so, that's the beauty in healthcare, that we can take a look at all of these things. Unfortunately, it's not what you see commonly in conventional medicine. Conventional medicine, unfortunately, is like you got high blood pressure, take this high blood pressure pill, or you got high cholesterol, take this high cholesterol pill. That's not how I practice. I do more of an integrative approach, and incorporate diet and stress management and exercise to treat those diagnoses that patients have.
Well, it's interesting because, I have a nurse that comes every year to monitor my health and, what I take and my medications, and that's what my insurance company provides. And every year she shows up and she says, get your medications. I get my 2 little bottles. And she says, where are the rest? And I say, that's all I take. And, most of the people she's dealing with who are my age they have like 10 bottles lined up,